your name is not only very popular here because of you're known as the COVID hunter, but you're also known as the doctor of Gary Valenciano. Uh, the wife is here. I saw
Mhm.
Angela here. But Dr. Varon, in the Philippines right now, there's so much debate about ivermectin. In fact, um, recently the DOH and FDA declared it illegal to use. Now the police are now arresting those who are distributing or giving out ivermectin. Of course, that's not a question that I wanted to ask you, but in relation to your fight against COVID, do you think ivermectin is very critical in in preventing and in helping those who are in the hospitals to recover, Dr. Varon?
That's a great question. So that actually brings me down to talk about the FLCCC, the Frontline COVID Critical Care Alliance. In March of last year, when all hell was breaking loose, we were trying to do things. We didn't know what worked, what didn't work. So at that point in time, five of us from the United States decided to create a small group of I'm going to call it clinicians that were caring for patients, but we're also people that are very well educated in the medical field. Dr. Paul Marik, Dr. Pierre Corey, Dr. Jose Iglesias, and Dr. Humberto Meduri. We would have these Zoom meetings at 2 o'clock in the morning, 3 o'clock in the morning, looking at ways to fix COVID. COVID kills you by two mechanisms. Mechanism number one, inflammation, a lot of inflammation. That, when your lungs get inflamed, you don't breathe, you die. But not only in your lungs, you get inflammation everywhere. Second way by which it kills you is excessive clotting. So when we realize this, we say, wow, we need to come up with a way by which instead of fighting the virus, like some of the other medications do, the remdesivir and stuff like that, we need to go and treat the active issues, inflammation and coagulation. So we created at that point our first protocol, which is called the MATH Plus protocol. And the MATH Plus protocol includes M-methylprednisolone, which is a steroid or cortisone-like agent, A, ascorbic acid, which you guys know as vitamin C, T, which is thiamine, which is another vitamin, and H, which is heparin. As we did this, we started to add more things into the mix. And, we were criticized. We were crucified. People said, you guys are crazy. You guys are going to give cortisone to somebody that's having an active infection. They're going to get worse. And surprise, surprise, people started to get better. At the same time, we started to use ivermectin in the hospital patients. And our results were amazing, but we didn't know why. So people started to use then ivermectin in the outpatient setting. And we created what is now known as the IMASC protocol. And again, all these protocols, all the medical rationale behind it, you can find it on our website at flccc.net. The reason why we did this is because people were dying, and we didn't want people to die. Your question, Congressman, is whether or not ivermectin is key on the treatment of patients. The answer is yes, but not just on the treatment, also on the prevention, on the prophylaxis of patients. Since then, we have endured in an uphill battle in the United States and around the world with institutions such as the Centers for Disease Control and Prevention in the US, the Food and Drug Administration, the World Health Organization. And it is amazing that people don't understand. Ivermectin, and this is what I'm going to focus, ivermectin has been around for 4 decades. It is the winner of a Nobel Prize as a medication. Ivermectin has been used 3.7 billion times in the world. Billion, not a million, billion times in the world. Ivermectin is considered one of the top 10 medications of the World Health Organization when there are catastrophes. It is an anti-parasite drug. Yes, it's for parasites initially, but we have come to understand that ivermectin has amazing antiviral and anti-inflammatory properties. And not only that, I mean, we are now using it even for patients that have the post-COVID syndrome. 50% of people that have symptomatic COVID, they will end up having all these aches, pains, headaches, things like that in the long run. And we've been using it and it works. So the question that I'm sure some of you guys are going to ask is, why hasn't the WHO or the CDC or anybody else say, hey, go ahead and use it? And I don't have any answer for that because the data is amazing. We have data from Bangladesh, India, Egypt, Argentina, Mexico, Peru, it is incredible, where you start a massive campaign of giving ivermectin and the numbers of cases of COVID just plummet. It is unreal. And yet these big institutions, they say ivermectin should only be used in the context of a clinical trial. That's what they say. I mean, they do allow us, at least in the US, to use it off-label. So I don't have the police coming in and, grabbing us, at least not yet. But it's been an uphill battle.
Last question, Mari. Thank you.
Yes,
Thank you again, Dr. Varon, for that. I'd just like to ask, again, Dr. Varon, there are supposed advisors of the government that say that ivermectin can cause severe adverse reactions such as neurological toxicity or brain damage after taking the ivermectin protocol. In your experience, Dr. Varon, have you had any of those cases?
Well, again, I would use their own data against themselves. If it was such a bad agent, why is it on the top 10 list of the World Health Organization emergency medications? That would be number one. Number two, 3.7 billion doses, not one case reported of neurological abnormalities, not one. There is really there is only one contraindication for the use of ivermectin, and that is for people that have kidney transplants, that they take another medication to kind of help them with their immune system. And the levels of that medication may shift to some extent when you take ivermectin. So in those patients, you can give them the ivermectin, just make sure that you check the levels of that other medication. But there are no contraindications. I mean, we're giving it to a lot of people, and it works. It works, but unfortunately, this is where all the drama begins. And I don't know how you guys do things in the Philippines, but I'll tell you, in the US, everything ends up being money. And this is where you have companies that are sponsoring medications that cost thousands of dollars to treat a patient with COVID, which actually don't even work, but like the remdesivirs and things like that, versus a $3 medication. That's where you start having that. It's a political situation, and I'm sure that, Congressman, you know more about politics than I do, but we see that here in the States. So what I'm doing is basically fighting a political fight. I'm not talking about science. I'm talking about a political fight. Simple as that. Economical interest. Of course, nobody's going to want to, pay $3. Let's pay the $6,000, especially if you are the one that is producing the $6,000 medication.
Thank you so much, Dr. Baron, for giving your time to us and, of course, for educating us and the Filipino people. Maraming salamat.
Thank you, Kong Mike, and thank you, Dr. Varon. Next question is coming from Arlene Ong. Arlene? Still muted. Please unmute. There we go.
Okay. Good morning, Dr. Baron. Good evening here in the Philippines. My question is, can ivermectin be used as prophylaxis to new COVID variants? And those who had COVID, can they still use it?
The question is well taken, and the data on ivermectin and variants is quite interesting. We actually have seen that in those areas that have a high number of variants, when you take ivermectin prophylactically or when you take ivermectin for treatment, the patients do better. Because again, ivermectin is a general antiviral, but it's also a very potent anti-inflammatory agent. So it helps you with inflammation, like I said, in the lungs, in the vessels that you have in your body, everywhere else. So yes, it can be used. Yes, there is some recent data on its use, especially on the variants, particularly on the British variant or the South African variant. And we recently started to see a very unique double variant that initially originated in India. And we know that those patients that had been taking ivermectin on a preventative basis on those areas where that variant was present, they didn't get it.
Okay. Mari, I have another question, last
Sure.
question. Doc, what age group can take ivermectin?
I mean, we are giving it pretty much to everyone. In the U.S., we are being a little careful with pregnant patients with ivermectin, even though there is no data that is going to do anything. But people like to be careful because this is the country where you get sued for everything. So, if the kid is not that smart in a few years, they may blame it on ivermectin. So that's why we're not doing it too much with pregnant ladies. But the youngest one that I have given it to was 3 years of age at the present time. Now, that is important to know because kids, they are somewhat resistant to COVID. You see, but the way COVID works is fascinating. So COVID, as you know, has these little spikes all around it. Well, those spikes are required for the virus to get into your system. And the way it gets into your system, the little spikes kind of attach to a little thing that's called a receptor. And that receptor is attached to different cells in your body. Well, interestingly enough, kids in their first 2 years of life, 2 to 3 years of life, that receptor doesn't work. It's not fully developed. So you can have the virus, but the virus doesn't attack the cell. So that's why we're not using ivermectin for kids that are younger than 2 to 3 years of age. But it is really, really cool. Another important thing, and this is important at least from a public health standpoint, that receptor that we talked about, even though most of the time it's in the back of the nose and in the lungs, is also present in fat tissue. So those people like me who are on the big side, we are like a magnet for COVID. That's why people who are obese tend to be one of the most common kinds of people that get COVID.
All right. Thank you, Tita Arlene. Admin, I'm going to jump the queue here a little bit and because baka napapagod na si Ma'am Mickey sa kakataas ng kamay. Ma'am Mickey Violago, we'll ask you to unmute. You can ask your question. Kanina pa kasi si Ma'am Mickey naghihintay. Okay.
Thank you and good evening to everyone and good morning, Dr. Joseph Baron. I just want to know if can we still drink ivermectin even though we had our first shot of vaccine?
The answer is yes. You should actually continue to take ivermectin. If you believe that the vaccine is going to be the fix for this, then I will tell you, continue to take ivermectin for a minimum of 8 weeks after you got your first shot, because that's the time it's going to take you to develop the immunity that's given through the vaccine. Now, please remember, the vaccine doesn't work 100%. So you may be one of those 5 to 10% of people that don't develop an immunity. And that is a reason why many of us, we continue to take ivermectin on bi-weekly basis. So we do it every 2 weeks or so, we take our dose. And that's one of the recommendations that I have done from day one. Until we know what's going on with all these variants, until we know what's going on with the effectiveness of the vaccine, I think that we should continue to take the ivermectin. Now, please understand, I'm not saying that ivermectin is a treatment. Ivermectin buys you time while the rest of your population gets vaccinated. And that is especially important on, from a public health standpoint. Ivermectin is not the answer. The answer is to get the vaccine. In this world, there are two kinds of people: those who have COVID and those who are going to get COVID. There is no way around it. It's like, having a flu. Everybody has gotten the flu at some point in time in their life. Well, the same is going to happen with Corona. What we want is we want you to get it, ideally, through immunization, through vaccination. And what I can tell you about ivermectin is ivermectin buys you time while everybody gets vaccinated. Ivermectin prevents deaths. One of you asked, how did we, quote, discover ivermectin? We didn't discover ivermectin. Ivermectin was discovered 4 decades ago. Ivermectin, we saw that it was being used in some countries where they have a lot of parasitic illnesses, and those countries have a lower number of cases of COVID. And that's when we said, let's give it a try. And yes, this has been a lot of a trial and error kind of thing, but it has worked. I'm going to call them enemies, but our enemies say that, we should be doing a randomized study where 50% of people get ivermectin, the other 50% of people don't get ivermectin, and see what shows. I think that a study like that in this pandemic is an unethical study. Why? Because I know that this works. So how come I tell 50% of my patients, I'm not going to give it to you. You may die, but that's okay, because I want to show to the world that it works. No, that's not right. It is unethical to do a randomized study.
Okay, thank you. And one last thing, how do we take ivermectin? Can we take that 1 tablet every 14 days or 1 tablet every 21 days?
The way you take ivermectin, you do it based on your body weight. And please understand, it's not just ivermectin. Our protocol includes the addition of other things. We add vitamin C, vitamin D.
Yes.
So it's not just ivermectin. That's why I keep on telling people to go to our website at flccc.net. We have the protocol has been translated. Actually, the website has been translated to 20 different languages so that everybody can understand it. The way you would give it, traditional use of ivermectin for prevention of COVID would be, you take your pill today based on body weight, depending on how much you weigh. Then you take your pill again the day after tomorrow. So that's 48 hours later. And then every 14 days, you take, 1 dose. And you keep on taking that until hopefully COVID is gone from this world and everybody's happy. It's not going to help you. It's not going to damage you in any way. And for sure, you are going to have no parasites in your body. So that's actually kind of good.
Thank you. And last question, please. Do you have any suggestion, or what are we supposed to do for the home care when we have a COVID patient? Because as you know, that hospital is our biggest problem now here in the Philippines because of the surge of COVID patient. What we should do for the first care or first aid that we can give to the COVID patient? Thank you.
Well, the first thing that you want to do with a COVID patient, make sure that the COVID patient doesn't give COVID to other people that are in the same household. That would be the number one thing. So isolation of the COVID patient is necessary. Then I am a big believer that you can take care of patients with COVID at home, provided that their oxygen levels are not low. That means you would have to check their oxygen levels. If their oxygen levels are reasonable, then you can treat them with ivermectin on treatment dosing. And the treatment dosing is just a dose today and a dose the day after tomorrow. I mean, it's not that difficult. And load them up with vitamin C, vitamin D. We give them melatonin at night. And you're going to say, why are we giving melatonin if it's a medication that people use to sleep? Well, interesting enough, the one animal in the world that has the largest amount of coronavirus in his body is the bat. Bats, the little thingies that fly. Well, bats have the highest concentration of melatonin of all animals in the world. That's how we came up with why are we giving melatonin. And we actually found that melatonin modulates your immune response, decreases inflammation that you have in your body. Again, the way by which COVID kills you is that inflammation. COVID has 3 phases. On the first phase, which is the first week, that's when the virus is actively replicating and doing all this crazy stuff. On the second phase, your body is reacting to the COVID virus, but the COVID is not dead anymore. But that's when you get the inflammation. That's when you get you start getting part of the clots. Your immune system doesn't work. And the third phase, that's when all hell breaks loose, when you have that increase in inflammation, when you have that increase in clotting. That's where your immune system is completely gone. It actually looks like if you have AIDS. Yes, AIDS, an HIV-related illness. That's why a lot of people believe that, this was a man-made virus that just went out of control because of the similarities with the response that you get from the HIV. So on the patients that you have at home, again, the recommendations is load them up on vitamin C, vitamin D, melatonin, give them their ivermectin. And depending on how they are, if they have a low oxygen, then we add steroids, where we add cortisone-like agents. However, in my experience, if their oxygen levels are low, you gotta go to the hospital. You gotta go to the hospital because in the hospital, they can give you all of these medications through the vein, and the effects are much faster than taking them by mouth. I understand the constraints about hospital beds, even the amount of oxygen that is available in some of the hospitals in the Philippines. But, the best bet is to have your treatment done under doctor supervision and not just do it at home.
All right, thank you, Dr. Varon. Also joining us this evening, our former USEC of the DOH, Dr. J. Del Mundo. TV5 is here, CNN Philippines is here, I believe ABS is here, and so is PTV4. If I missed anyone, please let me know. Philip Sea is here, JB Fabregas is here, George Barcelon, Ma'am Maite Defensor, and Dr. Edwin Bien. And that's let's go now to Nina Corpus. Nina Corpus can ask her questions. Hi, Nina. Sorry, I should have given admin more time. Dr. Homer
Yes,
Lim, you're
hi,
next after. Go ahead,
Larry.
Nina. Yes.
Yeah,
Go
hi,
ahead,
good
please.
evening, everyone. Hi, Dr. Varon. This is Nina Corpus. I'm a health journalist and health advocate in the Philippines, and I host a health web series called #Healthy Naman, and we're glad to talk to you tonight. My question is, what medications are not allowed to be taken with ivermectin? For example, medication for anti-TB, blood thinners, and the like, and also for common maintenance meds like for diabetes, hypertension, and cholesterol.
You can take any medication you want of the ones that you mentioned, anti-tuberculosis medications. There is no issue with any of those medications. People that take anti-tuberculosis medications on regular basis get blood work to make sure that their liver is not having any issue related to the TB medication. So on those patients, you also check the liver function on the basis of the conjunction of ivermectin and tuberculosis medication, but it doesn't give you any problem. Diabetes, blood pressure medications, cholesterol medications, no problem. As I said, the only one that we actually get a little concerned about is the use of a medication called cyclosporin, which is a medication that's used for transplant recipients. And the reason why we do that is because the levels of cyclosporin may go up or down depending on each patient. And you just want to make sure that that level doesn't fall below a number where they can get in trouble. But it's a very safe medication. As I said, think about it, 3.7 billion doses have been administered. It's one of those medications that have gotten the largest amount of sales for other things in the world.
Okay, Dr. Varon, I have a follow-up question. How about for people who who have lupus and cancer?
No problem. I mean, it's we use it all the time for patients that have rheumatological disorders such as lupus, rheumatoid arthritis, Jorgen syndrome. I mean, all of those things, not a problem whatsoever. As far as the cancer patients, also there is no issue. We give them to them at all point in time without any issue.
And what is an overdose? How high would it need to be if there is such a thing?
I have never in my life seen an overdose of ivermectin. I would imagine that, somebody would have to take like a whole, 50 or 100 tablets, but my only concern under those conditions would be liver damage, even though, as I said, there is really not one case that has been reported of true liver damage that can only be attributed to ivermectin, but that would be the only concern. So imagine a small child that finds the pills and eats them all, but they would have to be a lot because it's a very safe drug. Again, very safe drug. It used to be used in South America to cure river blindness, and they have not had a single case of river blindness in years since they started using ivermectin.
Okay, I have a last question. Going back to the question on how you take ivermectin when vaccinated, did you say you should take it 8 weeks after being vaccinated?
8 weeks after the first dose. So if
Okay.
you get your first dose today, then you have 4 more treatments of ivermectin if you're taking it from a preventive standpoint every 2 weeks. So you would take every 2 weeks your dose of ivermectin 4 times.
That's right after getting vaccinated. Can you tell us how long should we wait after, let's say,
As
the
I
first?
said, you are not going to develop full immunity with your vaccine for a total period of about 8 weeks, assuming that that you get your vaccine in 2 doses. It usually takes about 8 weeks to get the full extent of the immunity that you're going to have in your system. So I want to make sure that people continue to take their ivermectin for those 8 weeks so that they are protected. And as I said before, some of my friends in the FLCC, they continue to take their ivermectin despite the fact that they were vaccinated months ago. And they do so because they are concerned that some of these variants may not be covered by currently available vaccines. And ivermectin appears to have some protection against some of those variants. So they keep on taking it. And because it's such a safe agent, then you don't need to do anything special. Just keep on taking your medication. It's just once every 2 weeks. That's not that bad.
Okay, thank you, doctor.
My pleasure,
Thank,
ma'am.
thank you, Nina. Doctor, there's a question here from PhD Dr. Andrew Luzon. He's asking, transplant patient taking tacrolimus. In the President's Conference, you and another doctor said people taking tacrolimus should not take ivermectin. Is this true? What are the dangers?
Again, people that are taking tacrolimus,
Thank you.
it's another immunosuppressive agent that works through a same pathway as ivermectin. And again, in those patients, we have given ivermectin, but we check the levels of the tacrolimus, very similar to the cyclosporine that I was mentioning earlier. That's why people that have transplants, the decision of starting them on ivermectin needs to be done in conjunction obviously with the transplant team. Make sure that you don't mess up the transplant by giving ivermectin. But again, there are very few transplanted patients, so this is a minimal number of the total population. We are aiming to care for as many patients as we can and prevent as much death and disability as we can.
Thank you. Un poco de paciencia, Jimmy Fabregas. Okay. We have a long line. Just to warn the admin, Dr. Homer Lim is next, then Jimmy Fabregas, then Deputy Speaker Bernadette Herrera. Just very quickly, Dr. Varon, we actually did the math. It's if the lethal dose is 50 milligrams per kilogram of ivermectin, we're talking about over 200 pills at 15 milligrams per pill. Dr. Homer Lim, can we get Dr. Homer Lim unmuted so he can ask his question finally? After him will be Jimmy Fabregas, and then Deputy Speaker Bernadette, and then Patty and Dulce. we'll just jump through those who've been raising their hands for a while. Dr. Homer, go ahead, please.
Good, good morning, Dr. Baron. Good morning, good evening, everyone. So, Dr. Baron, from the beginning of this COVID pandemic, have you seen a shift in the way it behaves? Meaning, from initial symptoms, do we see a sudden change in how the patient's symptoms evolve? Has it become faster or slower? Because a lot of people are now so afraid and freaking out because they say once you get COVID in 3 days, you're already dead. So I guess that's the question.
Well, that's a great question, and the answer is no. You don't die in 3 days with COVID. I know that everybody thinks about it, but no. The problem is, a lot of people don't come to the hospital on time. My average patient coming to my emergency department takes about 2.5 weeks before they come to us, and of course, by the time they go there with one foot on the grave. And if you remember that this is a phase-specific illness. Remember I said there are three stages or three phases. On that first phase, the first 8 days, that's when the virus is multiplying. You are going to feel sick, you're going to have nausea, you're going to lose your sense of smell, taste, stuff like that. But you don't start having respiratory issues until the very end of that first phase. And it's during the second phase when you really start getting short-winded and things like that, you start developing some clots. And in the third phase, which is on the third week, that's when people die. That's when people get in trouble. So no, but the one thing we know is that time to treatment makes a difference. It's not the same for me to give you my Math Plus protocol on day 1 than to give you my Math Plus protocol on day 15. And that's one of the main reasons why a lot of the therapeutic interventions that we have had on COVID don't work. For example, remdesivir. Remdesivir will only work in the first few days of the illness because that's when the virus is active. But remdesivir does nothing for inflammation and clotting. The other one is convalescent plasma. Convalescent plasma doesn't even make sense, to be honest to you, because again, you have to have active virus to use it. By the time you come to the hospital, most people don't have the active virus. People don't want to go to the hospital for a variety of reasons. Number one, they are concerned that they're going to get COVID in the hospital, which is kind of dumb because they already have the COVID. Number two, they are concerned that they are going to die in the hospital. And number three, they're concerned about the financial implications of going to the hospital. Those are the reasons why people come to the hospital near death. And in my experience, they come in with one foot on the grave. I've had, yesterday night, I admitted a 21-year-old man that had symptoms for 3 weeks that almost died on me last night because he waited 3 weeks. And because, quote, he's young, he doesn't have any pre-existing conditions, so therefore nothing happens to him. Well, guess what? Now he's hooked up to a respirator and he's not doing too well.
All right. Thank you, Doctor. Jaime, all yours. Jimmy Fabregas.
Yes. Buenas noches, Doctor. I really just have one basic question. Porque in the Philippines, you know, we're in this situation where you don't know if you're getting the right meds for the right disease. So right now, my question is, there is an Ivermectin for pets, and there's an Ivermectin for humans. How are we sure that the Ivermectin that we are getting here is good for us? Because the people have been saying, you know, you have to differentiate. ¿Cómo va?
Well, thank you for your question. It's a good question. You know, in the United States, we've had similar issues, especially when we start having a low number of pills available on ivermectin. People started to go and taking the medication that they would give to their horse or to their cat or to their dog. I mean, I was actually thinking one day about taking my dog's heartworm medication and see what happened. But the quality of, at least in the US, the quality of the veterinary use ivermectin is very, very good. I mean, I don't encourage people to go and take their dog's pills or their cat's pills or their horse pill, but the quality in the US is very good. So that really depends on the quality control that you have in the Philippines and where is actually the medication manufactured. But in the States, we've had people that take it. And actually, I have even several slides where I don't know if you know, but ivermectin can also be can have flavors for veterinary use because horses don't like to take it, so they have it with apples flavor, they have it with other kind of flavors. So people are actually taking it with flavors, and that's actually very common also in South America, where it became very difficult to find. So veterinary use, it's something that I don't encourage, but can be done.
So
hope that
it
answers-
is. You're saying that it can be safe. We can take the veterinary.
I think at least the one that we have in the States is safe. I'm not familiar as to which one you guys have there, but again, I wouldn't endorse it. But if I hear that somebody got it, I think that they don't have to worry. I mean, they are not going to start barking or doing anything like that.
Muchas gracias.
Un placer. Un placer.
Okay, Deputy Speaker Bernadette Herrera. Good evening, po.
Thank you, Mary. Hi, Dr. Baron. Thank you for your time. Well, I'd just like to ask a clarificatory question so that the Filipino people will also be guided, because some are under the impression that if you take ivermectin, it's an alternative to the vaccine. Like you said earlier, you're taking ivermectin and you also got yourself vaccinated. So does that mean that despite the fact that we take ivermectin, you strongly recommend that we get vaccinated here in the country?
Without question about it. I think that vaccination is the way to go. For those of the people that are watching us tonight that are concerned about vaccines, vaccines, you are not going to grow a tail or have a third eye. I mean, the side effects that you'll have related to the vaccine are very minimal. And the vaccine is the light at the end of the tunnel. We need to vaccinate as many people as we can. And as I said, ivermectin is not the answer, but it buys us time. It buys us time to get all of these people vaccinated and to have less casualties. It is a shame that, there are so many people that have died around the world because of this terrible illness. It is a shame, for example, that in the US, we have 560,000 people that have died. We are a powerful country, and yet people don't listen. The other part that you need to understand is not just vaccination, it's not just ivermectin, it's common sense. As I was saying before I started this meeting today, I've been fighting two wars. I've been fighting a war against COVID, but I've also been fighting a war against against human stupidity, because people are doing the wrong things. If you keep your safe distance practices, if you continue to wear your mask, if you avoid going to crowded places, the chances that you will get in trouble are very low. And those are simple little things that all of us can do, but yet we don't do them. I mean, that's what we fight for.
Does it matter which vaccine, or all vaccines available are recommended?
What I tell people, when you are in a public health emergency like we are right now, the best vaccine is a vaccine that you have available to get. That's the best vaccine that you can do. So I think that that's the message to everybody. I mean, if I have to choose, I would like to choose, Moderna or Pfizer. That would be my personal choice, looking at some of the data and, side effects. But in reality, you get what you can get. You are not picky. This is not a time where we can be picky and say, oh, I'm not going to get this or that vaccine. I mean, you get whatever you can get at the present time that is available in your country. Because obviously you guys have a regulatory agency that gets an idea of the safety of the medications and stuff like that. For example, in the US, we have not allowed the AstraZeneca vaccine yet because of the concerns of some of the clots and things like that they're having. But the other three vaccines that we have allowed in the US, they seem to be reasonable. I mean, yes, there are concerns. People say that there are over 2,000 cases around the world of people that have died and they thought that it was related to the vaccine. But, people die every day from other things that didn't get a vaccine. So the temporal association to this is so weird that I still think that in the long run, and looking at the number of people, your best bet is just to vaccinate, vaccinate, vaccinate.
Thank you, Dr. Baron. My last question. FDA just recently started approving compassionate special permit for ivermectin here in the Philippines. And some are worried because normally you get CSP if a person is critical in the hospital and they would take it. And we're afraid that if it doesn't work, so I just wanted to know, does it work for critical patients? Are we on the right track here in the Philippines, or are we just setting ourselves for a trap in case that it doesn't work for critical patients? Then they might not recommend it also for prevention, and that is what worries us. That's why I want to know if we are setting ourselves a trap in having it approved as a compassionate special permit. Does it work for critical patients?
The answer, that's a loaded question, because the answer is yes, it works, but depending on the stage that the patient is. Remember, I said it works on the 3 stages, but as the stage progresses, you have less and less effectiveness. So yes, you are correct. You are setting up yourself for failure, and that is a concern. Instead of them using it early, where you can actually show that it's a much stronger effect, you are giving it when the person already has, scarring of the lungs, and the patient needs a new pair of lungs. And well, ivermectin doesn't grow lungs again. I mean, those are things that people need to understand. It works like any other therapeutic intervention in COVID. The sooner you start it, the better off you are.
Thank you very much for that, Dr. Varon. That would really help us a lot here in the Philippines. Thank you.
It is my pleasure.
Thank you, Diaz. A question from while I allow admin to find Patty, who will be next. A question from the comment section. Can you ask Dr. Varon if we can use pentoxifylline for COVID, ebastine, and also tramadol? It will be a good help for us doctors who treat COVID in private settings.
Well, of the medications that you talked about, the one that is interesting is that pentoxifylline. Pentoxifylline, actually what it does, it deforms, or it actually makes the red blood cell a little more pliable. And it's very interesting because, as I said, one of the main things that COVID does, it gives you a lot of clots. So in those areas that have clots, having more red cells going to the area can actually make the clot bigger. And pentoxifylline may just make that red cell a little more pliable, that can go through a smaller flake. So it's interesting. We actually have one study that we're doing with Panama as we speak on the use of pentoxifylline for patients with COVID, but it's a late stage. The other medications that were mentioned, the tramadol, there is not real effect. It's not contraindicated. You can use it. It's mostly for pain. The things that work, and I tell people that I throw the kitchen sink to my patients with COVID. We've been doing a lot of things, and again, what I do today is not what I used to do before. Before, I used to use things like colchicine, which was shown in Israel to make some difference, but yet we start using it didn't work for us. Right now, we're using an antidepressant which seems to work, which is called fluvoxamine. It also has its own little thing. We use something that's called ciproheptadine. I mean, we throw everything. Patients that come to me that are very sick in the hospital, we give them a very large dose of cortisone. We give them vitamin C in what I call industrial doses. We give them 25 grams every 12 hours by vein. So, I mean, we're talking about huge doses, but they do well. My mortality rate for my patients in my hospital with COVID is 4.4%. That's the lowest mortality rate in the entire US. The average in the United States today, mortality rate is about 20 to 25%. Ours is 4.4% using this protocol. And this has been replicated by, the place where my other 4 friends are in the US.
All right, thank you, Dr. Patty. You're next.
Thank you very much. First, I'd like to say thank you to Dr. Varon and, of course, the organizers for really helping educate the people. Now, my question is, for ivermectin, being used as a prophylaxis. I know it's been said to be antiviral, antiparasitic, and I believe it's also antibacterial. Now, if you drink ivermectin for a prolonged time, my question is, do we have any data whether this affects the good bacteria in our guts? Because I'm aware that they said you have to have a good balance of good bacteria and I guess some bad bacteria. Now, if it's antibacterial or antiparasitic, if it does affect the good bacteria, would you suggest that if we're going to be drinking it for a prolonged time, we should also supplement with probiotics or prebiotics so we can protect our good bacteria in our gut?
So far, we have not had any issues of bad bacteria. So far, there is no data that has actually given any of such problems. And some of the best studies where it's been given on prophylactic uses, both in Peru and in Egypt, they actually look into whether or not anybody had side effects related to, diarrhea or things like that. Nothing, none of those things. So as of now, there is no reason to do that. Now, a lot of people just use probiotics on regular basis, regardless of whether they take any medication or not, just to keep their gut health better. I have no issue with that, but we don't routinely do that. Now, remember, we're using the ivermectin every 2 weeks. It has a long half-life, so it stays in your body for a long period of time. That's why you don't have to take it so often. And that's one also of the other beauties about it. I mean, it's just you're dosing every 2 weeks, and that's it. At some point in time, we were dosing it once a month, and then another time we were dosing it once a week. But we actually have found that every 2 weeks is probably the best dosing regimen.
Okay, thank you very much. That gives us some comfort.
Thank you, Patty. Thank you, Dr. Baron. Dulce Cepeda, you're next.
Yes, good evening to all those in the Philippines and good morning to the people of America. And thank you, Dr. Varon, for this talk. Now, my question is related somewhat to the question of D.S. Herrera. Okay, I've been listening to a lot of talks and I've been reading a lot of things about ivermectin. Now, the reason I'm taking ivermectin is because in my understanding is that ivermectin protects the cells, the virus from entering the nucleus of your cells. Therefore, it's just the virus will just stay outside and they die. Now, and because they die, you don't even become a carrier. And from the data that you have been presenting, it seems like ivermectin is has a higher rate of batting average as prophylaxis for prevention, for treatment as an early treatment, or maybe the middle stage or the later stage, but not the the worst stage. Now, I take ivermectin because I do not like vaccine, and I feel I'm already protected. But now, I'm not a doctor, but I've listened to a lot of doctors who've been saying that vaccine is not necessary because it's already protecting you. Now, why will it be used just as a bridge? If it can protect me as a bridge, why can I just take it the whole time? Now, I've heard a lot of, there are also doctors who are vaccine experts. I've heard them and they said that we should not take the vaccine because it has more side effects. And now the people taking vaccine now, I've been reading, they still get COVID even after the vaccine, and there are people who even die. In other words, ivermectin being safe, it is so safe that you can take it. I mean, why should I take the vaccine, which to me is not safe?
That's a very good question. And, that's a question that I answer almost every day because, believe it or not, 40% of my own nurses that work in my COVID unit, they don't want to be vaccinated for similar reasons to the ones that you mentioned. The one reason that I would tell you behind getting the vaccine is quite simple. You want your body to do the work. You want your immune system to be the one defending you rather than something external that you are getting, your pill. But I have a lot of people that have your same point of view. I respect your point of view. One of the reasons why we want to do the vaccination is so that we vaccinate enough people so that there can be some herd immunity. And with that herd immunity, you can protect others. So in some extent, you do the vaccination, one, so that your body can protect you by itself instead of getting a medication from the outside, and two, so you can help others once enough people are vaccinated. But to get to that herd immunity, we're talking about 70-80% of the global population, not just the Filipino population, has to be the global population. So that's one of the reasons why I say that. But getting a vaccine is very similar to what I tell people to wearing a mask. When you wear a mask, you do so to protect the other person more than protecting yourself. So yes, I know it sounds a little crazy, but I truly believe that when you're getting a vaccine, you are thinking about others. In addition to thinking about you, you are thinking about others. You are thinking about others in the sense that hopefully this herd immunity will be able to protect all of us at some point in time, and this crazy pandemic will be finished once for all. At least the sooner the better, because I need a day off.
All right, thank you, Dr. Rafi Bosana. You'll be next after Dr. Andrew Luson. Dr. Andrew?
Yes, doctor, I am a liver transplant. I'm taking tacrolimus, and I read somewhere, I heard you at your news conference, be very careful, only a very small window of people, which includes me. And then I read somewhere that the two drug together could damage all the muscles, and the urine will be coffee color and stuff like that. Very terrible names. My question is, can I take ivermectin, and what should I monitor? Did I monitor my FK level? Of course, the liver function. And then the next question is, can I be vaccinated? Some doctors said I should not get those with virus like Sinovac and Astra, and I must only get Pfizer and Moderna. So two questions, one vaccine, which one? And second is whether I can take ivermectin to protect myself.
My best suggestion for you would be, number one, the decision of whether or not you should take ivermectin and the vaccine are directly related to what your transplant team says. So you really have to sit down with the transplant team. With regards to ivermectin, as I said, as long as the levels are checked, you correctly mentioned, you need to make sure that your muscle enzymes are checked. I don't think that that's too much of an issue because you have a good transplant team. But some transplant doctors are concerned about ivermectin in conjunction with tacrolimus and some of the other medications that you may be taking. With regards to the vaccine, absolutely, you need to be vaccinated. Actually, I just admitted a patient that he was my first patient that I admitted that he had he had the Johnson & Johnson, which is a single dose vaccine, and with liver transplant, and he did get COVID. He got COVID 3 weeks later, actual COVID. So having the vaccine, as you know, it doesn't prevent you for sure, but at least it decreases the chances. As far as which vaccine I would give to you, I agree with your transplant doctors. I agree with what you have seen. Your best bet is to get an mRNA vaccine such as Pfizer or Moderna. I don't particularly like Johnson & Johnson because just as some of the other ones, it has a virus that has to go in. So basically, we're giving you a virus into your system. And for people that have chronic decrease in their immune system, like you are with the liver, chronic immunosuppression, you never know when that virus is going to wake up. That's my primary concern.
My wife is a breast cancer hysterectomy 12 years ago. She's cancer-free. What kind of vaccine can she take or cannot take?
Whatever vaccine, doesn't matter. For her, doesn't matter. Whatever vaccine she can get.
Okay, and 1 to 10, she has to take the vaccine.
Absolutely. Absolutely. Get her to get the vaccine.
What do I measure for the muscle deterioration?
We use an enzyme that's called creatine phosphokinase, CPK. That's the one that tells you, whether or not there is any muscle damage.
Okay. Thank you very much.
My
Thank you.
pleasure, sir.
And congratulations for your championing this cause. It's what you're doing is really heroic.
All right. Before we ask Congressman Mike a couple of questions, we'll go to Marion Salonga. Marion, go ahead, please.
Yes. Good morning, Dr. Varon. Okay, I'm Marion Salonga, and this is my question. I was watching the news, and there are some people, they were fully vaccinated, and yet they still caught the virus. And the vaccines that they took were Moderna and Pfizer. So what can you say about that?
Oh, fairly straightforward. I mean, if you remember, the effectivity rate of these vaccines is about 95%. That means that there is 5% of the population that still don't develop an immune response. Now, one thing that you should remember is that it doesn't mean you are not going to get the illness. Being vaccinated doesn't prevent you from getting the illness. You just get the illness in a much lower rate. And most of these vaccines, what they do is they prevent you from getting so sick that you end up in intensive care and you die. That is the primary reason why you get vaccinated. You don't get vaccinated because, quote, I'm not going to get COVID. No, you get vaccinated because you are not going to get the COVID that kills you. That is why people need to be vaccinated. I have seen a series of patients that got the vaccine and had COVID, but their COVID was much milder. It wasn't as bad as ending up in intensive care and things like that. That would be about 95% of people. But yet there is still about a 5% of the general population that gets vaccinated whose immune system doesn't produce any immunity. And those people can still get the illness. For that reason, getting the vaccine doesn't mean you can go out to a large mass gathering without a mask and do whatever you want. You still have to be protected because you have no way to know whether or not you are protected unless you get antibody testing. And that, for a lot of people, it's not that easy. I mean, it's not practical.
Okay, so there's no guarantee, right?
Yeah.
It doesn't serve as a protection. Am
Correct.
I right?
There is no guarantee. I mean, you are better off with the vaccine than without the vaccine. There is no question about it. You are better off with the vaccine because you know that at least you will not get the bad illness that kills you. That's the one thing where the vaccines make a difference. But still, there will be a small percentage of the population that have the potential to get infected despite of the vaccine.
One last question. What can you say about Zimbabwe? The people in Zimbabwe, they all took ivermectin. And you can see a lot of them just got healed, got cured of COVID.
Well, again, we don't know the exact extent of what they have and stuff like that. I mean, if you look at some of the other African countries where ivermectin has been widely used, their success rate is tremendous. The number of cases are low. Zimbabwe has also their quality control for the medications is not the best, and there has been some concerns about that. So that's the only thing that I can comment. The data is coming out, and it's a little sketchy, to be honest with you. We're actually reviewing it as we speak.
Thank you, Marian, and thank you, Dr. Varon. Some housekeeping before we call on Kong Mike. Rafi Bosano, we can't find you. If you can just raise your hand, please. Rafi Bosano, just raise a hand. Okay, Kong Mike, a couple of questions for you. We can refer to you the question earlier asked by Jimmy Fabregas. Considering those concerns about where the ivermectin is coming from, whether it's coming from veterinary ivermectin or human grade, what can you recommend as far as the reputable sources for ivermectin in the Philippines?
Yes, thank you for that, Mari. For the information of Dr. Varon, as was mentioned earlier during the discussion, the FDA and the DOH closed down some of the producers of ivermectin here in the Philippines, and they have threatened the doctors that will prescribe ivermectin on an off-label setup like what you have there in the US FDA and NIH. But anyway, for all of those watching now, there are two allowed compounding laboratories in the Philippines, NextMed and LifeCore. So NextMed of Dr. Homer Lim is here. LifeCore of Miss Carol Tanchay. These are the compounding laboratories allowed. I'm not sure about the others, but I understand. I've been getting requests where they can get, where they can buy. And precisely what's happening now in our country is that because of this, we're not even sure if we're getting the correct ivermectin because people are smuggling in ivermectin. People are producing, though that's the problem. In the US, I understand Dr. Varon and his team, the FLCCC, were able to reverse the NIH and the FDA so that off-label is now allowed. And that's why the first question I asked Dr. Varon was that, is this essential in the treatment and prevention? And I think that was answered by Dr. Varon. So thank you for that.
Okay, Kong, one more question. Given those current guidelines of government, what would you advise people who want to avail of it? Where do they find it? Are we limited to just those two compounding labs, NextMed and what was the other one? Sorry.
NextMed and LifeCore,
LifeCore,
from what I understand. Because there are three, and the other one I don't think is producing. Apoteca is not producing ivermectin. So where can we get? Your guess is as good as mine, but we some of us are part of a thread. See, Dr. Homer is having problem already with his production. He can't produce enough. Yes, Dr. Varon, that's our problem here. In your place, the compounding laboratories can do it. They can make it, and you can supply as much as you want as to the grade. So yeah, Mari. So as not to burden Dr. Varon, I think we'll find ways. In fact, today we just got a police report. Some of them are being watched and would be arrested for supposedly even distributing for free ivermectin. So thank you.
Thank you, Congressman Mike. Dr. Varon, a quick question from the comments. What happened to Brazil? Why are doctors saying that ivermectin failed in Brazil? Marisa Buenaventura, you're next.
I mean, one of the concerns was whether or not, we were dealing with a different variant and that the variant was not covered by Brazil. But more importantly, the concern was quality control one more time. I mean, Brazil started to produce a lot of ivermectin. We're not sure that it was given at the right time, the right dosing to those people that needed it. And then Brazil went wild as far as infections go. It really got out of hand. And again, there was no specific effort at trying to prevent this because there were early reports in some of the different areas of Brazil where ivermectin had been given, and indeed was one of the first countries in South America trying ivermectin that were fantastic. So again, the rest of countries in South America have shown a fantastic improvement in the number of cases of COVID. More recently, and this is just data that I saw yesterday, we have data from now from Mexico, where specific states in Mexico decided to give ivermectin free of charge to people. And those states, when you look at the number of cases, those are states where the cases drop to almost nothing. So that would give you the idea that maybe at the government level, if you can have a huge campaign where you are giving ivermectin to your citizens, maybe you will be able to decrease the number of cases while trying to convince the population to get vaccinated.
All right, thank you, Dr. Marisa Buenaventura. You're up.
Hi, doctor. If a person has had a history of anaphylaxis, so it's already contraindicated for the vaccination, can they take ivermectin instead for life?
Absolutely. I would definitely recommend to that person to have that. Now, having said that, we have had patients that have had anaphylaxis to the flu vaccine and things like that. And what we do for those people is we pre-medicate them with specific medications, and we watch them in a special area where we give them the vaccine. So having had anaphylaxis to a different kind of vaccine is not necessarily 100% contraindication, but of course it carries a risk, and if it is going to be done, has to be done under 100% supervised facilities. But those patients, definitely I would put them on ivermectin.
All right. Will it affect their liver if taken for life?
No, it shouldn't.
All right. Thank you, Doc.
Topax Kolaiko, you're next.
Yes,
Go
sir.
ahead,
Thank
please.
you. Thank you, Mar. It's very clear that it's a no-brainer to take ivermectin. There's nothing to lose and everything to gain. So my question was I'm 77 years old, fairly healthy, and I just got notification that I can get my vaccination, Sinovac, next week. I asked my doctor, he said, if you're not going out anyway and you're healthy, and as I know, you take your walk under the sun every day, just keep on your ivermectin and let's wait until there is more vetting of Sinovac, because there's so many negatives that we've been hearing about Sinovac, in that, especially if you're a senior. Because earlier when they offered Sinovac, there was a disclaimer that this should not be provided to seniors. And all of a sudden, the government said, this will now be promoted for seniors. Now, I'm a senior, and I find that odd. Why should that, on a risk-reward ratio, why can't I just wait? I think I can manage in a few months. If it's clear, then I can get the right vaccine. The second question is mRNA, as I understand it, is the first time this technology is being used for humans. Is that true, doctor? And if so, what are the risks?
Excellent. So let's talk about both questions, and let me kind of split them up. First of all, the fact that you are staying at home most of the time and you just barely go out does not protect you 100%, because people will come to your home. You will have people that will deliver things to your home. You will have, unless you are in a bubble, there is no way you are going to prevent human interaction. So they may bring you the COVID with them. So that by itself, I would respectfully disagree with your doctor and say, hey, you still have a chance of getting it from somebody bringing it to you. That's number one. Number two, as I said earlier, the vaccine that you get is whatever vaccine you currently have available. Now, you are very right in that we are now enduring the largest human experiment in the history of mankind. I mean, we're giving millions of doses of vaccines that are recent in order to try to prevent more deaths and disability. When you put this as a balance, I mean, to me, it's a no-brainer. I mean, it's either get sick and die, or get a vaccine of which you don't know the long-term effects, but at least we know that it decreases the number of cases. I tend to go for the vaccine. With respect to your other question, as far as mRNA, well, the mRNA technology really has been developing for the last several decades. It was not President Trump that just got it last year. What President Trump did is he put in a lot of money to get companies to get studies and get things going. But this is a technology that has been going on for a while. Now, as far as coronavirus mRNA technology, yes, that is new, because not even during SARS or during MERS, we were able to develop a vaccine fast enough to cure such two illnesses. We don't know too much about it. And I'm going to be very frank and honest. Yes, we don't know what's going to happen. But what we know is that COVID is killing people today. COVID is killing a lot of people. And one way to prevent more deaths at the present time is to provide vaccination. Of the vaccines that are available, as I mentioned earlier, I tend to favor more Moderna and Pfizer. We don't have Sinovac in the US, but I have heard some of the concerns that you are mentioning it. And over there, the decision needs to be yours and your healthcare provider. You guys need to sit down and see what's best for you on the basis of available data from the Philippines or from other places with regards of the safety of the vaccine. But if it was me, I would get vaccinated.
Thank you, Dr. Baron. Gigi, hi. Go ahead, please.
Oh, hi. I have to unmute myself.
You're
Hello?
unmuted. Go ahead. We can hear you.
Okay, thank you. Hi. Good morning, Dr. Baron. Um, But do you believe the efficacy of the ivermectin, that it would really help save a lot of people's lives? Because there are a lot of people who have issues with autoimmune, and I am one of them. And I would rather wait for a few more years, probably a year. And as I wait, I would be taking ivermectin. And so, would you agree that it would also still be safe for me to be taking ivermectin as I wait for the right vaccine I feel like would be available in the future?
I mean, your question is well taken, and you are correct. You can take your ivermectin while waiting for whatever vaccine you think it's better for people with autoimmune disorders. What I don't want people to think is that I'm saying that ivermectin is the answer to COVID. The answer to COVID is vaccination. The answer to COVID is for all of us to be immunized. But I do understand as well that there is a specific part of the population which may have serious concerns because of pre-existing conditions like autoimmune disorders, and you don't know how your immune system is going to react to the different variety of vaccines. And that I respect. But I don't want people out there to say that Dr. Varon is saying that, don't get vaccinated, just use ivermectin. No, by no means. On the contrary, people need to get vaccinated. Ivermectin is just a crutch that we are using while we learn how to walk with the vaccine. That's as simple as I can put it.
Thank you so much. And another question, doctor. The protocol here in the Philippines, once admitted in the hospital, is that once they have COVID or once they have pneumonia, they actually give remdesivir. And I have seen a lot of my friends go through this, and they develop, they go through dialysis, and eventually some of them die. So, what is your take on this issue? Because this is a protocol in the Philippines, doctor.
Well,
it's a protocol to take.
The first thing is, protocols were made for people to follow them if they think it's proper for the patient. Every patient is different. I don't use remdesivir. I don't believe in remdesivir because remdesivir, as I said, only works in the very first stages. And actually, the recovery study basically showed that it doesn't work. So I don't use remdesivir. And remdesivir, like you correctly mentioned, has the potential to mess up even more your kidneys and end up requiring kidney dialysis and things like that. So again, if you're going to use an agent, might as well use an agent that doesn't give you trouble. And remdesivir doesn't take care of the inflammation. Remdesivir doesn't take care of the clotting, and people will die because of that.
Thank you so much, doctor. Thank you.
Thank you, Dr. Baron. Cynthia Ubalde, go ahead, please.
Hi, good evening, Dr. Baron. I'm a patient who has bronchiectasis. Is it can I be vaccinated?
Absolutely. You should be vaccinated because you are at a very high risk. People that have bronchiectasis tend to be the ones that, you can get the pneumonia that you can get can be much worse than just a regular pneumonia from COVID. So absolutely, you need to be vaccinated as soon as possible.
Because since 2013, I'm having the pneumonia yearly. But the problem is just like we are talking about the vaccination we have in the Philippines. Is it okay to take any kind of vaccination?
As I said, in your case, I would take whatever vaccination I can get as soon as feasible before you get COVID. COVID plus bronchiectasis is a bad combination.
Okay, thank you very much.
No problem.
Joy Abon, go ahead, please.
Good morning, doctor. I'm from Houston, and our family. We had 4 of us had COVID, and ivermectin was prescribed to us. I just want to say that my husband was not able to take it right away. It took 48 hours before we could get a hold of the drug, and that's why his case was a little bit worse than the rest of us. My son, who is 17 years old, he was taken for a swab, and right away they asked him to had X-ray because he was having hardness of breathing. He had very high fever, but he took ivermectin, and the next day he only had sore throat. nothing at all. He was playing computer games all throughout his quarantine. For me, I took it as early when my husband had it, and it took me like 3 weeks before, like the viral load got to me, but I didn't have any fever at all. All I had was cough, and that's it. Anyway, my question is for us who had COVID and we tested positive for antigen, do we still need to take ivermectin, or do we now have natural immunity?
The problem with natural immunity is that people that have had COVID, especially fairly severe COVID, that immunity disappears over time. The best studies are studies that were done in South Korea, and actually they show that within 3 months, most of that natural immunity is going to go away. So you're probably okay for a period of about 3 months. Now, one thing that is extremely important for you to understand is that having had COVID doesn't prevent you from having the other kinds of COVID, the atypical variants. I've had a patient that have had COVID 3 times, and each one of the times has been a different variant. So I would say people as such probably should take ivermectin. It's just prophylactic. And again, in your case, I probably wouldn't vaccinate you in the first 60 to 90 days, but vaccination for you, it's very important.
Yeah, I want to add, I have a friend who had COVID May last year. What she did was she continues to donate blood, and up to now, she still has antibody. So that was May last year.
And again, things happened, and I don't disagree with that. I have seen people that have had stuff. However, the vast majority of people, their antibodies will disappear within a period of 3 months. That's why, again, one more reason why you should not feel invincible when you have had COVID and then you say, hey, I can go anywhere, I don't need to wear a mask and stuff like that. Just keep on using your universal protections, and stuff like that. Don't go anywhere without a mask, especially in Houston.
Thank you.
Diane Castillo, Dr. Jade, and Ronnie, and Dr. Edwin, you'll be next. But before that, Arlene Ong, please.
Yun. Tawagan ako.
Okay. Marlene, your turn.
Ay, sorry. No,
Again.
kasi there's a question from my friend. He is asking, he had already 2 doses of Sinovac, March and April. Can he have another vaccination after a certain period of time using Moderna? Because the first and second will be Sinovac. So is it possible to have another vaccination after a certain of time? But it's Moderna, another brand.
Everything is possible. Is it advisable? No, it's not advisable. You should have only the same vaccine that you had, and that's it. I would not give him any other vaccination at the present time. Now, if over time we learn that the antibodies decrease with Sinovac or with Moderna or with any of the other ones, and the patient requires another booster, then at that point in time, that may be a consideration of using a different kind of vaccine. But I don't recommend mixing and matching or even getting stuff. People think that because you got Sinovac and now you have somebody that can get you Moderna, you should get it. No, please don't do that. You're going to feel very, very sick.
Thank you. Thank you, doctor.
Thank you, Doctor. Diane Castillejo, that's you. You're next. Trying to unmute you. There we go. Unmute, please.
Hi, Dr. Varon. And thanks, Mary. I wanted to ask, because my dad's 91 years old and my mom is 80, and they started taking ivermectin. My 2 questions are: should they continue taking the ivermectin on a 2-week interval as a prophylaxis, and for how long should they take that? And should they? I'm sorry if this question was already asked earlier or similarly, but should they be vaccinated for both my parents who are, my dad has dementia and taking some medicines, but not that much. What would you recommend, sir?
Absolutely, as far as the vaccine. My father is 96 years of age and he got vaccinated a couple of weeks ago. And yes, I mean, They're going to feel a little sick, but the advantages of vaccinating them are huge. So please go ahead and vaccinate them. So no question about that. As far as the ivermectin, I would continue to give it to them for as long as this pandemic continues to be there, or at least until 8 weeks after they have been fully vaccinated.
Until 8 weeks. So after they've been vaccinated, no more ivermectin.
I continue to give them the ivermectin for a period of 8 weeks from the first day of the vaccine, the first vaccine.
Okay, fine. Oh, sorry, just a quick follow-up question. My dad is kind of sensitive to medicine in general, like he usually has reactions. That's why I'm a little bit apprehensive about giving him the vaccine. What can you recommend?
Well, again, I mean, the benefit of getting the vaccine is huge. And yes, there are concerns about people getting side effects. As long as that is done under doctor's supervision, you shouldn't have a problem.
Any kind of vaccine, any of them?
Whatever vaccine you can get available.
All right. So the 2 weeks of the apart for ivermectin is good enough?
Yes, absolutely.
Okay, thank you. Thanks, Mary.
Thank you, Diane. Doc J. Del Mundo, go ahead, please.
Good morning, Dr. Baron. My question is, in Panama, they have a kit, a bag, which they give to the population, and it contains losartan. This is an ACE inhibitor, which could inhibit the virus, no, especially when it attaches, the spikes attaches to the receptors in the alveoli. What is there a rationale for using losartan?
There was some data initially that actually showed it worked, but as I said, the problem is that by the time the patient comes to you, there is no more virus in the system. I mean, they're already in phase 2 or phase 3, so giving losartan doesn't work at that point in time. We did the same for a variety of other things that we said that it wouldn't attach. For example, I don't know if you remember, we were using azithromycin, what we were giving doxycycline. To date, we continue to even give famotidine, which is something that we use for ulcers and stuff like that. Again, those are things that supposedly prevent the virus from attaching to the receptor on those cells. But the data on losartan is very poor. We're not using it because of the potential side effects. People drop their blood pressure and then they faint and they have all sorts of things. So we're not using losartan at the present time.
Yeah. My second question is, do you have any comment on molnupiravir?
Yes, don't use it. Doesn't work. I mean, yes, I have a comment. Yeah, that's it. Again, and so that I mean, we use them all. I use them, every single one of the ones that you guys are mentioning. We use them all. And, we would use them. It was a little bit of a trial and error. You try it, doesn't work, next. So, and that's what we've been doing. That's why I said, what I do for my patients today is not the same thing that I was doing 20 weeks ago or a year ago. We've been evolving slowly. We've tried them all. I mean, we tried it, CellCept, we tried everything. I mean, we look at what would make a difference.
Thank you very much, Dr. Baron.
No problem.
Okay, Ronnie and Aris, go ahead,
Yes.
please.
Thank you, Mary. Good morning, Dr. Varon. I'm now getting a little confused. Just several things. Number one, ivermectin. What is the property of ivermectin that fights against COVID, actually?
Well, there are several. Again, the first one, it does have antiviral properties. It actually, when you give ivermectin to somebody that has a very large viral load, their numbers go down. So it kills the virus. But more importantly, it also has this anti-inflammatory capability. So it decreases inflammation that the virus produces. That's why not only is good in the initial phases, but it's good throughout the phases. And now, as I said at the beginning of this lecture, we have actually found that ivermectin even works for patients that are having the post-COVID syndrome. those people that develop symptoms after they had COVID for several months.
Okay. Anyway, it's funny because I'm 70 years old. I have hypertension. I have COPD. I have asthma. And I just finished my blood chems last January, which included a 2D echo and all that stuff. And I wanted my heart doctor not to prescribe ivermectin, but just to look at my numbers and tell me if it would be okay and not indicative to take ivermectin. Just to give me the okay that it won't kill me if I take it. And she doesn't do that. So I feel insecure. I don't know what to do.
Well, very simple. You're just doing it. You are just asking me. There is no contraindication. Take it. It's very simple. Very simple. Even if your echo was bad, even if some of those things were bad, I would still give you the ivermectin. The advantage of giving you ivermectin, the very minimal chances of getting any kind of side effects outweighs anything else that anybody else can tell you.
Thank you, Doc. Doc, one last quick question only. I thought I heard you say earlier that you do not prescribe getting the vaccine that has the virus in there.
Correct.
I think
correct.
So if that's the case, what are the vaccines that do not have that virus? Is AstraZeneca one of those?
Yeah, well, AstraZeneca is one. I'm not too happy with AstraZeneca. I like Moderna, I like Pfizer. Those are the two that I really feel confident on. Now, as I said, you take whatever vaccine you have available, and sometimes things would happen. For example, the Sputnik vaccine, the Russian vaccine, the president of Argentina got his vaccine in January, and now he has COVID. So they don't 100% protect you. That's why you have the ivermectin kind of like as a just extra help.
Yes. Dr. Varon, God bless you, and thank you so much for taking all the time to answer all our inane questions. Thank you very much.
It is my pleasure to be able to help.
Thank you, Mari.
All right, thank you, Ronnie. Dr. Edwin Bien, go ahead, please.
Thank you, Mari, and thank you also to the friend of Dr. Varon, Rosario Ginto, for inviting me. I'd like to say also condolence to another friend here, Joy. And to my friend here, I'd like to say hello to a fellow member of CDCPH, Dr. Lim. First of all, thank you very much, Dr. Varon. I know it must be tiring for you. As a fellow doctor, I understand you on your stance again about the vaccine. But real talk, perhaps the good congressman can correct me. You have been here in the Philippines, Dr. Varon. We are about 110 million Filipinos. Very few of that, maybe about 10-15% are senior citizens. Now, there's only about 2 million vaccines available here. Now, if we are looking at herd immunity, we must reach at least about 50 to 70% of the population. So if that is 70 million Filipinos, it's a long way to go before we reach that level, knowing that we only have about 2 million vaccines in the country. So, since we are only vaccinating the frontliners and we are only vaccinating the senior citizens, there are so many Filipinos that are below 40 years old that will not see vaccine maybe 2 or 3 years from now. Now, because it is difficult for us to find the ivermectin, Dr. Varon, about a few months ago, there are some US doctors who were talking about hydroxychloroquine. Would you please say a little bit about that, knowing that it's difficult for us to find ivermectin nor get the vaccine within 2 to 3 years' time?
Excellent. Thank you for your question. So, I used to be a heavy hydroxychloroquine user for my patients because, like I said, things have changed over time. Hydroxychloroquine, when used in the hospital setting, to us appeared that it was doing the trick. The problem with hydroxychloroquine, as you know, it can give you some issues on your EKG. It can give you a couple of other things. That's why I didn't like to prescribe it to everybody as an outpatient. couple of studies were published in the last 6 months that actually showed that hydroxychloroquine was probably not efficacious. It was not hurting people, but it was probably not efficacious. And there has not been a one-to-one comparison study showing hydroxychloroquine versus ivermectin. Now, you know that hydroxychloroquine also became a very politically challenged drug. Unfortunately, President Trump liked it, and people that didn't like President Trump, they went over all these fights. And I think that was one of the main reasons why people stopped using hydroxychloroquine. As I said, I used it extensively up until about, I would say, September of last year. Since then, I have not used it for my inpatients, but before, every patient that came to the hospital, I was giving it to them. And again, there were some rationale behind where to use it. Primarily, it's used, again, early. It's prevention of attachment of the virus to the cell. In addition, some of the immunomodulating, that means the effects of on the immune system of patients. But at the present time, and because it's so politically charged, we have elected not to use hydroxychloroquine. That's number one. And number two, I definitely don't give it to patients on an outpatient basis because it can modify their EKG, and you never know. I mean, somebody can get in trouble. That's why if I'm going to use it, I would use it in the inpatient setting only.
Thank you very much. Thank you.
Doc Homer has a question. Dr. Homer again.
Hi again, Dr. Baron. So my question is actually on the high dose vitamin C. During the beginning of this pandemic, when we had this initial surge last year, I was already advocating the use of high dose vitamin C. So my question would be, are you using the same, are you using this protocol of 25 grams of vitamin C every 12 hours? Is this based on the Shanghai study? And second, I think everyone should also understand, why are you using high dose vitamin C for COVID patients? Thank you.
Okay, so I mean, you nailed that perfectly. Yes, this is based on the Shanghai study where, people that had COVID and were seen in one of the Shanghai hospitals, they got 25 grams every 12 hours of vitamin C, and they did well. The reason why we use vitamin C actually goes back to the data of Paul Marik, my friend that is part of the FLCC. And Paul and I, we have been working on vitamin C for patients that are having generalized infections, what we call sepsis, for many years, and we've shown it works. Now, it works because vitamin C regulates your immune system. It works because vitamin C is a huge antioxidant, and when you are having infections, including COVID, there is so much oxidation in your system, you can get in trouble. So that's why we started using it. Now, this dosing of vitamin C, yes, we kind of lifted it from the Shanghai study where we saw that the results were actually quite impressive. We continue to use it, but we don't use it. We don't use it for all the patients. We just use it, the high doses of vitamin C. We only use it for those patients who are very sick. How do I know how sick they are? Well, I do that based on what their CAT scan shows, based on what their oxygenation is, and then I make a decision. When I give them the high doses of vitamin C, I'm usually giving them also a very high dose of one of the steroids, methylprednisolone. I tend to use up to 1 gram every day for a period of 2 or 3 days. Most of my patients that don't have that amount of illness, that are very sick in the hospital, we use 3 grams of vitamin C every 6 hours. Now, all of that is done intravenously. For patients that are being seen as an outpatient, I recommend that they take 2 grams of vitamin C, a minimum of twice a day. I take it 3 times a day. That's probably another reason why I haven't gotten that sick. I take my vitamin C and my vitamin D every single day.
All right, we good, Doctor? Thank you. Okay, last 2 questions, but before we take our last 2 questioners, that's Lex Lau and Dr. Jade again. Let me ask these questions from the comments. Dr. Baron, what stage of COVID do you give famotidine?
On the very beginning. I usually start them on at the very beginning because that's when you have the antiviral properties of famotidine. So at the first stage is when we started.
All right. And what is the dosage for famotidine, and what about fluxobamine?
For the famotidine, we do 20 milligrams intravenously every 12 hours. For the fluvoxamine, again, fluvoxamine is an antidepressant, and it's an antidepressant that has been shown to actually have anti-COVID properties. We usually start 50 milligrams once per night, and within 2 or 3 days, we go up to 50 milligrams twice a day. There are some people that like to use higher doses, but people can get a little anxious when you do that, so I try to avoid anxiety. I already have way too much drama in my COVID unit to have more drama.
Lex Lau, can you unmute, please? Lex Lau?
Good morning, Dr. Joseph Varon. Thank you for giving us your time and for your service, not only to the Philippines, but to the entire world. I just want to clarify, for a kidney transplant patient, 60 years and above, you have mentioned that ivermectin is not advisable. If this is the case, vaccination would be the only option. Which type of vaccine would you recommend for kidney transplant patients?
My recommendation for kidney transplant recipients is that they get either Moderna or Pfizer, mRNA vaccinations. I would not recommend that they get anything that has a virus active or inactive on it, just like the Johnson & Johnson or some of the others.
Okay. Thank you, Dr. Joseph Varon, for your time and for your answer.
Thank you. Dr. Jade, unmute, please, and go ahead and ask your last question.
Dr. Varon, which is the best antioxidant, antioxidant, vitamin C or N-acetylcysteine?
Without question about it, vitamin C. On a face-to-face studies where we actually compared vitamin C antioxidation properties and NAC and some of the other ones, there is no question that vitamin C by far is the best. And it's, the beauty about vitamin C is cheap, is easy. You can find it everywhere. Yeah. I actually have some little strips that you actually put in urine, and you can tell how much vitamin C you have in your body. I mean, you don't even have to do it in blood, and it's super easy. You can even take it to your friends and say, hey, let's see how much vitamin C you guys are taking. I chew up vitamin C. I mean, I'm probably a giant lemon. Actually, yesterday, I went to play racquetball in the morning, and I was having some cramps, and I had some Filipino mandarin juice just to get rid of my cramps. I said, hey, here goes my dose of vitamin C for the day.
Thank you very much.
Okay, one final question from Sir George Barcelon. Admin, can you find Sir George? If you could raise your hand, that might make things a little quicker, Sir George. George Barcelon. Okay, unmute. Please unmute, Sir George.
Okay, no, I'm here. Anyway, thank you, Dr. Varon. I mean, you've been very accommodating to all the questions that's been thrown to you. My question is not related to the medical side of it. My question is more regarding the herd immunity. That we're doing this exercise, getting mass inoculations and the likes. I just want to give you some timeline. So far, from the secretary of, the one in charge of the vaccination, we would be getting only about 4 or 5% people vaccinated by May or June. Okay, the volume of vaccine that will be coming in bulk is sometime in July and August and onward. So the vaccination practically will start on the third quarter of the year. And they're targeting something like 200,000 vaccinations a day. And that will bring us all the way to maybe second quarter of 2022. Now, the question is, if it dragged for a period of almost 1 year, would those people who were vaccinated before still be effective? I mean, because as of now, the vaccination efficacy is just about, Pfizer says could be good for 6 months. but the other brand hasn't come out yet and say categorically that this is good for 1 year. So what happened next? So that's one question. And is ivermectin a good first line of defense? You take vaccine, you get vaccinated. At the same time, you continuously take ivermectin for, well, I don't know for how long, wherein your body would not have any adverse effect. So those are the two questions I'd like to ask Dr. Varon. Thank you.
That's actually excellent. You know, it's usually the last question, the one that are the best questions. Your questions are fantastic. And let me just start by saying, you know, what Pfizer had just said, that their vaccine is good for 6 months. Well, it's good for 6 months because they just have data on 6 months. They don't have data at 9 months or 12 months because people have not yet had that information. So we don't know. And that's the answer I need to tell you. We just don't know how long this vaccine is going to be good for. Whether or not you are going to require a booster, I personally think you will require a booster on regular basis because this virus is constantly shifting. So it's going to be like the flu, you know, every year you have a different strain that you're going to be dealing with. I think that's what's going to happen. There is no question about that. But the second part that you said is, I think that you got that right, perfect. And that means using ivermectin can help you right now, at least in the Philippines, based on what you said, 2 ways. Number one, it buys you time. It buys you enough time for all of those people that will be vaccinated over the next, 18 months or whatever period of time that will be. That's number one. And number two, until we know how long we have immunity for, this may be a way to, again, buy us also time for those people that have received the vaccine. So I truly believe that that is the gist of what ivermectin can do for you.
May I have a follow-up question, Dr. Varon? Isn't it we human, we have what we call the T cells. We have our inner mechanism that develops immunity. If we are given enough time, do you think our T cells will be able to adjust to the various strain of the COVID-19? Or do you think that we will be sort of addicted to being vaccinated every year, or like the flu vaccine?
Humans over millennia have been able to go through all sorts of pests and pandemics and stuff like that. We have adapted. What a very adaptable animal. However, how many people are going to die while we go through that adaptation? That's what we don't know. So I do believe that, again, vaccination will be required for a period of time. I just cannot tell you what period of time. It's just like, with smallpox. Well, we now don't need to vaccinate anybody else for smallpox like we used to before. You remember some of the other illnesses that are slowly disappearing over years. So hopefully COVID will be one of those in the long run. I don't know if I'm going to see it on my own lifetime, but, hopefully it will disappear.
Thank you very much, Dr. Varon.
Thank you very much
Thank you very much, Dr. Joseph Varon, for all your time. Mambeng, I'll turn over the floor to you.
Oh, yes. Thank you so much for everyone who joined our webinar with Dr. Joseph Varon. One quick request from Dr. Varon. What would be your suggestion or your statement for our government in the Philippines for the betterment of my countrymen? Especially right now, we are really in a catastrophe side that we don't even have enough hospitalization, beds, and some people are really having trouble getting in the hospitals. They are staying inside a tent or outside the tent as well, and the rate of mortality is increasing on a daily basis. There is really a battle cry in my country. That's the reason why I really intended to do this webinar for my countrymen, so that there would be an alignment and there would be a clear setup, for them to realize how crucial we are now, that this is no longer a game. It's not, where the chicken came from. It came from the egg and the egg came from the chicken, and this is our lives. We need to act right now in my country. I would like you to suggest, or whatever opinion that you could tell to the government or whoever official agency responsible, so that we could help our countrymen.
Well, I have I have two answers for that one. The first one is the official one. The second one is a funny one. So the official one would be my recommendation to the government of the Philippines is that they consider giving free ivermectin to people for prevention of COVID. Simple as that. That would be my recommendation. Would be go ahead, give it in large quantities to everybody. I mean, just make it free of charge, and that will decrease the cost of healthcare. The second answer, which is the best one, is just take me to the Philippines. I'll be happy to help you distribute that, because I need a break. And
But
what a
make
better
sure
thing.
your
Yeah, I can be on the beach of Boracay, just kind of giving the ivermectin to anybody that comes in.
But make sure you have to take ivermectin with you.
Absolutely, I'll bring tons of ivermectin just to make people happy.
You need this is your weapon.
Absolutely, that's my weapon. That's my secret weapon.
Yeah, mine as well. That's why I have it with me.
Okay.
All right. Let's turn it over now to Congressman Mike Defensor for his closing words. Come on. Congressman Mike.
Thank you. Before Dr. Varon, before I give the closing remarks, I see Mr. Gary Valenciano here. I think he'd like to say hi to you. Just a quick hello. If we can unmute Mr. Valenciano.
Gary V.
Gary V. Yeah, I think just to unmute, please. Okay. Oh,
sorry.
There you go. Hello, Dr. Varon.
Hey, Gary.
How are you? Good to see you here. I
Good
just want to
seeing you.
thank you. I
Oh,
want to
you're
just give a little background to everyone that I met Dr. Varon some years ago, and he has taken care of me, during the times when I really needed somebody to check out what was going on with my lungs and all. And I'll never forget when he told me to have an X-ray in the hospital so that he could see what was really going on inside. And as I was seated out there in the waiting area, a Filipino nurse comes out and she goes, "Oh, Gary V." And I said, "Yeah, that's me." And she goes, "Why are you here?" And I said, "Well, there's something going on with my lungs." And she asked me who my doctor was. And I just said, "Dr. Varon." And her reaction was like, "What?" Well, I'm sorry, Dr. Varon, I have to say this, okay? But she said that he was known to be the miracle doctor in that area, no, because of the way that he would conduct, and that the way he would work and find answers for patients that were really struggling to live. And so I just want to thank you, Dr. Varon. My wife, actually, Angeli, is here, and she said, "So what would be?" This is just my question to you, Dr. Varon. But what would be the safest dosage for people in general? Because, like me, I've had the bypass. I'm a type 1 diabetic for I don't know how many years now, quite a number of years, and then I have the hypertension. I'm taking medication and all. So what? It's like 2 tablets every 3 weeks. Is that the standard?
Well, what we would do is somebody like you, Gary, because of your weight, probably we would give you 12 milligrams or so, 12 to 15 milligrams, depending on your current weight. And we would give you one today, then one the day after tomorrow, and then every 2 weeks, one tablet of 15 milligrams of 12 milligrams. Again, that's based on body weight. That's how we do it. But most people between 12 and 15 milligrams. And again, it's one tablet every 2 weeks. That can't be that difficult to do. And you look great, by the way. You look amazing.
Well, I wanted to apologize because I came from. I'm trying to stay healthy, because I haven't had the vaccine. Is not with me. I can get some ivermectin. I think my wife has some, but I was always like weighing the pros and cons. And I'm thankful that everybody asked the questions that they needed to ask, because it kind of settled and answered some of the questions I didn't even have in mind initially. But yeah, so I just came from a workout, and then I just came right here because Angeli said, my wife said it was still ongoing. So I came here. But Dr. Varon, on behalf of all my countrymen, I thank you so much. We're all looking for ways and means to not just keep ourselves okay, but the ones that we love okay as well.
Absolutely.
And thank you so very much. And Congressman Defensor, thank you so much also for being here, because at least you heard it from a doctor who I can vouch for talaga. So thank you.
Thank you.
Thank you, Gary.
Yes, thank you, Gary. Mari, before I thank Dr. Varon, let me just thank Arlene Ong. Earlier, Dr. Varon, I wanted to ask what Ma'am Beng Ginto asked you, but I didn't want to be imposing. But thank you for for asking Beng, and for Dr. Varon for his recommendation. Charina Sarmiento is also here with us, our nurses in the US. Joey Salvanera. We have our technical group, Alvin Nunez and Dexter Ngo. Si Joy pala, I'm sorry, Joy Salvanera. Alvin Nunez and Dexter Ngo, they're the ones helping us here. Of course, CDCPH, led by Dr. Biani, and our very able and capable host, Mari Kaimo. Thank you so much. Dr. Varon, thank you for your patience and for your time, for answering all the questions. Of course, thank you for your service to humanity. You are God sent. We thank you for that. And thank you for your love for the Philippines and the Filipino people. And yes, we would like to host you in Boracay and in El Nido anytime. Thank you so much, Dr. Varon. God bless you. And God bless everyone. Thank you so much, Dr. Varon. Mabuhay po kayo.
Bye-bye.
Bye. God bless you all.
Mil gracias,
Mabuhay
Doc.
Pilipinas. Mabuhay kayo.
Thank you, Ma'am Beng. Good night, everybody. Thank you for joining us.
Thank you, Mary.
Have a great
Congressman
day.
Mike, thank you for all the support. George Barcelon, PCCI.
Thank you,
sir.
Dr.
Thank you,
Baron.
Mr. President.
Thank you.
Bye.
Appreciate much. Question and answer? Would like
Oy, Ma'am Beng, thank you. Your name is not only very popular here because of you're known as the COVID hunter, but you're also known as the doctor of Gary Valenciano. The wife is here. I saw Angela here. Dr. Varon, in the Philippines right now, there's so much debate about ivermectin. In fact, recently the DOH and FDA declared it illegal to use. Now the police are now arresting those who are distributing or giving out ivermectin. Of course, that's not the question that I wanted to ask you, but in relation to your fight against COVID, do you think ivermectin is very critical in preventing and in helping those who are in the hospitals to recover, Dr. Varon?
That's a great question. So that actually brings me down to talk about the FLCCC, the Frontline COVID Critical Care Alliance. In March of last year, when all hell was breaking loose, we were trying to do things. We didn't know what worked, what didn't work. So at that point in time, 5 of us from the United States decided to create a small group of, I'm going to call it clinicians that were caring for patients, but were also people that are very well educated in the medical field. Dr. Paul Marik, Dr. Pierre Corey, Dr. Jose Iglesias, and Dr. Humberto Meduri. We would have these Zoom meetings at 2 o'clock in the morning, 3 o'clock in the morning, looking at ways to fix COVID. COVID kills you by 2 mechanisms. Mechanism number 1, inflammation, a lot of inflammation. That, when your lungs get inflamed, you don't breathe, you die. But not only in your lungs, you get inflammation everywhere. Second way by which it kills you is excessive clotting. So when we realized this, we said, wow, we need to come up with a way by which, instead of fighting the virus like some of the other medications do, the remdesivir and stuff like that, we need to go on and treat the active issues, inflammation and coagulation. So we created at that point our first protocol, which is called the MATH Plus protocol. And the MATH Plus protocol includes M-methylprednisolone, which is a steroid or cortisone-like agent, A, ascorbic acid, which you guys know as vitamin C, T, which is thiamine, which is another vitamin, and H, which is heparin. As we did this, we started to add more things into the mix. And, we were criticized. We were crucified. People said, you guys are crazy. You guys are going to give cortisone to somebody that's having an active infection. They're going to get worse. And surprise, surprise, people started to get better. At the same time, we started to use ivermectin in the hospital patients. And our results were amazing, but we didn't know why. So people started to use then ivermectin in the outpatients.